But plans for health service reform have attracted growing opposition, not least because they'll encourage more private organisations to provide healthcare alongside the NHS.
We're going to lose the NHS if we don't start fighting for it.
This weekend, campaigners turned out for a rally and march in Truro to protest against the changes.
The kind of changes that they're making would actually hand the NHS over to the private sector, which we're totally opposed to. We think there needs to be a fundamental stop. We're pleased that there's this pause that the Lansley, the Minister, has agreed to, but that needs to be real change.
Cornish Liberal Democrat MP Andrew George wants the government's entire health bill scrapped. And Conservative MP for Totnes, former GP Sarah Wollaston, said the reforms were like tossing a grenade into the NHS.
The Patients Association and bodies representing hospital doctors and GPs are also critical of the scale and pace of the proposed reforms, not least because they're happening at such a challenging time, when the NHS must find £20 billion of savings to pay for increased demand for services, the needs of an ageing population and new drugs and treatments.
David Cameron's agreed to pause the progress of the health bill to consult staff and patients, but said today the shake-up was essential to ensure a healthy future for the service.
There's only one option we've got, and that is to change and modernise the NHS, to make it more efficient and more effective, and above all, more focused on prevention, on health, not just sickness.
But many people are afraid too fast and too radical a change will damage their precious service. Sally Mountjoy, BBC Spotlight.
Well, Dr Michael Dixon is a Devon-based GP who supports the plans for GPs to take more control of NHS spending and represents doctors on the issue at a national level. I asked him why he believes the reforms would be good for patients.
Well, I think it means that the services locally will be decided by GPs, clinicians and nurses, not by managers in Whitehall setting targets which often seem ridiculous at the front line. After all, as a GP locally, I know the services well, I know my patients well, so aren't I in a better position to decide how things might be improved or if cuts have to be made, where they have to be made, than someone in Whitehall?
Why should patients have any confidence in these changes, though, when there are so many people opposed to them? People such as Dr Hamish Meldrum from the BMA say that the bill needs to be changed so radically it's probably best to start all over again. And Professor Stephen Field, who's leading the listening exercise, says GPs don't always have the skills to commission key sorts of health care, including maternity and end-of-life care. If there's that sort of opposition within the health service, why should patients have any confidence in it?
Well, I think the problem with the bill is there's so many different things in it. There are some things that are very, very good indeed, like GP commissioning and allowing how the NHS is run to be the responsibility of local clinicians and people. There's some things which I think people do quite rightly question. That's to say the influence of the market. I think that's Hamish Meldrum's point, that we don't want to have a system where, if you like, there's lots of people competing to provide services and they become discoordinated and unintegrated, and I think that can be answered. I think that GP consortia can make sure that happens, but there does need to be changes to the legislation to stop there being central control to encourage market when local people and clinicians don't need it.
Indeed, that seems to be one of the greatest concerns, that effectively it's privatisation through the back door. And isn't there an inevitability to that if you've got private suppliers who are offering cheaper services, that's where the doctors are going to go and the NHS will lose out as a result?
That is a danger, because private providers will often loss lead and cherry pick and all the other market tactics that private providers use. But that's why it's so important the GP consortia locally must be in the driving seat. And if they need some market and competition because a hospital or a provider isn't delivering very well, then they can bring it on. But if, for instance, Derriford or Exeter or other hospitals are providing the service they want, then they should be able to choose to talk to those hospitals to develop and improve the services together and not be going out to the market. The important thing is that the degree of marketisation is under local control, and the danger under current legislation is that it might not be.
OK, Dr Michael Dixon, thank you very much indeed for joining us.